Hello, my name is Alan Prost, and today we're going to talk about blood gas vector analysis in our short video. This is part of Res 312, a course in our respiratory therapy program here at SAIT. Okay, to help us along with this video today, it'd be really useful if you've copied the blood gas, algorithm, and vector analysis sheets. These are available off the WebCT course. You can follow along with the video and also give you a little space on those pages to write down some notes. Okay, so what are we going to do? We're going to talk about why we should use vector analysis. I'm going to describe how it works and how we utilize it, and I'm going to give you some case studies that we're going to work through to do vector analysis. Okay, let's start off with blood gas algorithms. To understand how vectors are important, you need to understand the algorithms because you need to understand the classification system. So you need a background and understanding of the classification system. What's different about the vectors is that you're going to see a graphic representation of each of the classifications instead of just this kind of table format as the algorithms show us. The algorithms are very useful, and it does get us talking about all the different types of classifications, and that's useful for us. But the problem is that there's a disjoint between just following the numbers and coming up with a classification for a blood gas rather than actually understanding how the CO2, pH interrelate to get us to this classification. So why study vector analysis? Because this is a nice visual way for us to analyze a blood gas. Alright, we're going to identify both the metabolic and respiratory components or factors that are influencing our patient, and we're going to come up with a classification system that we understand. Alright, it'll help us identify the patient who has a large metabolic acidosis or is in ventilatory failure, for example. Okay, how does it work? The first thing you need to do is you need to be able to calculate the predicted pH from the blood gas CO2. Now, this is actually measured right from the blood gas machine, so we'll get that number right from the blood gas machine. There's a key elements here in that, as we know, CO2 rises, pH falls. Alright, so our predicted pH with a high CO2 should be lower than predicted. That's why we're using minus here. So we take our normal metabolic pH and we're going to subtract how much the effect CO2 has on that to get us to a predicted pH. Now, the amount CO2 is altered is 0.006 units per unit of CO2. Okay, I'll show you how that works in just a minute. What's important to realize right now is that if the CO2 is higher than predicted, or excuse me, is lower than predicted with a CO2 less than 40, what's going to happen to our pH? Well, we know it's going to be high. Alright? High CO2, acidosis. Low CO2, alkalosis. That's why we have a different effect here. Alright? These two equations will capture that. These factors, 0.006 and 0.01, are different because the effect on acidosis is mitigated by the blood buffers. Let's not talk about that too much today. We'll talk about that in class. Let's just talk about how to do the vector analysis. So here's a good blood gas. We've given the results from the blood gas machine. We see the oxygenation, we see the pH, we see the CO2, and we've got our bicarb, and we've got our base excess. Okay, first things first. What do? We're going to calculate the predicted pH change. So I've got a CO2 of 55. I know my CO2 is higher than normal. Alright, normal's 40 millimeters of mercury. This is definitely higher. What's the result of that going to be on my pH? Well, I'm going to have a lower pH. I've got a high CO2, so I'm going to have a lower pH. I know my patient's acidotic just due to the CO2 buildup in the body. CO2 is an acid, so how much is it going to alter our pH? Well, let's take our 55. We subtract 40. That gives us our change in units, 15 units of change. We multiply by the factor, 0.006. And we get 0.09 units of change from our pH. We know it's going to make us acidotic, so we subtract it. That gives us a predicted pH of 7.31. So, because my CO2 has risen from 40 to 55, I'm going to have a decrease in pH of 0.09 units, giving me a resultant pH of 7.31. This is important, and we're going to use this. All right, so how do we use vector analysis? Well, the first thing we got to do is just draw a line, all right, a representative line, and that's what I've shown here. We're going from our acidosis to alkalosis, and in the middle we've got 7.40. It might be useful to keep in mind our range of normal blood gases. All right, so a normal pH would be anywhere from 7.35 to 7.45. This is our normal range. The body's going to do whatever it takes to get us in that normal range. So on the right side, this side represents alkalosis. On the left side, this side, it represents acidosis. All right, so now we're orientated to our basic line. So how do we use this? The next thing we do is we draw the respiratory vector. From our standing normal pH of 7.4, we're going to draw how much of a shift in pH is due to that CO2 acid in the body, just from the respiratory component. So remember, we're going to use the predicted pH because for that change in CO2, in this case, I've got a high CO2, I know that my predicted pH has got to be lower. All right, how much lower? That's what the equation tells us. I'm going to have a pH of 7.31. So let's draw that on our vector analysis. So the first vector we're going to draw is our respiratory one. All right, so this tells me I've got a CO2 of 55, and I'm going to have a decrease in my pH to 7.31. So I draw that as a vector. Okay. Now, the next thing we do is draw the metabolic vector. Now, we start from the end of the respiratory vector. That's always important. So start from the end of the respiratory vector, and we draw this to represent the change in pH due to the metabolic components. Note, I don't have to be accurate in this. Okay, so my first vector, the respiratory one, which I labeled R, was due to change in pH due to the CO2. Now, what happened in the body is that I have a greater change in pH. So my first component, my respiratory component, took me to from a normal pH of 7.4 to 7.31. Then my metabolic component took me further down to a pH of 7.25. Okay, well that's interesting. You notice I'm drawing each one of them separately. Each one of these is a vector. Well, how do I analyze this kind of results? Well, the way I start off with, I look at the respiratory component. Okay, so a high CO2 results in a low pH. All right, captured that with my respiratory vector. All right, so my respiratory vector, I drove my pH down because I wasn't ventilating enough to get rid of this acid, this CO2. Now, what happened in the body besides that is that my metabolic component drove me even further down so that I'm even more acidotic. So this classification would be a combined respiratory and metabolic acidosis. Both of the vectors are taking me in the same direction, making me acidotic. All right? For a combined acidosis, it really doesn't matter which one's greater at this point. We could do a look at the variations in pH to see which one's contributing more, but that's not critical at this time. All right, let's review the rules of vector analysis. Firstly, the longest vector is the major effect. All right, so the longest vector indicates the major effect. When both vectors go in the same direction, this results in a combined effect, and that's just like the one we just saw. All right, that's a combined effect. If the vectors are in opposite directions, this is a compensatory effect, and I'm going to show you examples of that in just a minute. If the metabolic vector has no effect, then it's all due to the respiratory component. So we'll check that out as well. I'm going to show you an example of that. Okay, let's get busy. First case study. I've got a high CO2. All right, high CO2 that results in a low pH. All right. How much? Well, I used my equation to tell me how much change in CO2. So I just, from this buildup of CO2 acid in the body, I should have a pH of 7.28. So let's draw a vector. Here's my pH of 7.40. And remember, I said it might be useful for us to actually put down. Remember, you don't have to be accurate here. This is my normal range of pH. I know that this is alkalosis and that this is going to give me acidosis, all right, on this side of the vector. So let's plot this out. Okay, let me just change ink colors here. Okay, so let's plot the respiratory component now. So I start off from my pH of 7.40, and I know that I'm being driven down toward the acid side of the equation. I've got a pH of 7.28. All right, you don't even have to put that number in. You just know this is the respiratory component of my blood gas. Now let's plot the metabolic component of the blood gas. So I've got a pH of 7.36 in this zone. So I start here from my point of my respiratory, and that's bringing me back this direction now to a pH of 7.36. All right, that's my metabolic component. Well, isn't that interesting? I've got two different factors happening here. I've got the respiratory component drawing me down, making me acidotic, and then my metabolic component is bringing me back towards that normal zone of pH. So what do I have occurring here? I've got a respiratory acidosis that's occurring, but my body has compensated to try to bring me back to that 7.36. So we'd classify this as a compensated respiratory acidosis. The major effect is the respiratory component. Look how long of a vector that is. So that's how I came up with the compensated respiratory acidosis. The metabolic effect is slightly less, but it's important because it's bringing me back. It's the compensation factor that's getting me back so my body is within that normal zone for a pH. This would be consistent with a patient with COPD, for example. Okay, let's look at another example. Let's look at another case study. Let's start off again with just drawing our basic vector. So we'll draw our line. We're going to indicate normal pH 7.40, and here's our two indicators of 7.35 and 7.45. We know on this side we're indicating that we had acid buildup, and this side is our alkalosis. Okay, let's look at our gas. Starting off with the CO2. Well, I've got a low CO2. Okay, so the result should be that my predicted pH should be high, and in fact it is. Put it through the equation. Now it's important to draw the little arrows and think that out in your head so that you get an idea of if you've done the right math. Low CO2 should be alkalotic. So let's draw that vector. I'm going to draw that vector in blue. Alright, so start off with a pH of 7.40, and it's driving me towards the alkalosis side because I'm breathing too much. I'm blowing off a lot of CO2. It's making me alkalotic. So that's going to drive me to a pH of 7.50. But look what's happened on our metabolic component. Let's draw that in a different color. Now, we start at the end of our respiratory vector, and look what's happening is it's driving us all the way down here, making us acidotic to a pH of 7.21. Wow. Okay, let's label those. I've got my metabolic component and I've got my respiratory vector. Let's always remember to label those. So what does this show us now? Wow, That's kind of cool. Well, what I'm seeing is that our ventilatory component is driving us to be alkalotic, but I've got this huge metabolic acidosis that is keeping me on the acidotic side of the equation. So even though I'm compensating with my ventilatory drive, I've increased my minute ventilation, all right, so I've blown off the CO2, I've reduced the CO2, giving me a lower predicted pH. My overall effect on my patient is that I'm still acidotic. So what classification would this be? Well, this shows that I'm partially compensated metabolic acidosis. Now, how did I choose the metabolic component? Well, we know that it's metabolic because we've got this huge vector for our metabolic. So the longer vector dictates what is the major component being affected here, and it's metabolic acidosis. The respiratory vector is showing me how the body's trying to compensate. I've increased my minute ventilation, lowered my CO2, trying to compensate for this huge metabolic acidosis. So the best classification fit would be partially compensated metabolic acidosis. And I think this vector analysis really highlights that very clearly. If I couldn't blow off my CO2, you could see I'd be even more acidotic without this shift or pulling over by the respiratory component of the gas. All right, let's do another example. This is fun. This is cool. All right, let's draw our basic vector here. Get started. Oh man. Just bear with me for a second while I get my computer to work. All right, here we go. So we're going to draw our basic line on here. We're going to indicate our 7.35 to 7.45 normal blood gas. All right, I know that this is the alkalosis side and this is our acidosis side. Okay, so let's come up here to my CO2. All right, well, let's change colors here so I can highlight that. All right, so I've got a low CO2. I've got a CO2 of 30. What does that mean for my pH? Well, my predicted pH then should be higher than normal. Low CO2, high pH. So let's draw this on my vectors. All right. So I've got a low CO2. So I'm going to be driving my CO2 again to the alkalotic side. And that should give me a pH of 7.50. Now what's happening with my metabolic component? Don't rush into your analysis just yet. Let's draw the metabolic component. So the metabolic component starts here and it takes us down to a pH of 7.36. So I've got my respiratory component here and my metabolic component here. The metabolic component is longer, so it's the major effect, all right, giving me an overall pH of 7.36 is my final pH. Okay, well, how do I analyze this now? How do I analyze that? Well, let's go through it. The respiratory component is making me alkalotic, then the metabolic component is bringing me back or making me acidotic. Well, the major effect, the longer vector, is the metabolic. The respiratory is the compensatory mechanism. All right, so here once again I've got a metabolic acidosis, but it's been corrected. It's brought me back into the normal kind of range of pH which the body desires. So I've got a compensated metabolic acidosis. Does that make sense to you today? All right, work through a few examples. The longer vector, the metabolic vector, is still only bringing us back into a pH of 7.36. We've compensated for this metabolic acidosis by hyperventilating, blowing off our CO2 to make us alkalotic, to correct for this metabolic acidosis. So without any information about our patient, this would be the best classification that we could utilize. All right, let's work through one more example before we call it quits for today. Okay, let's draw our basic vectors. Alright, so we start off, get orientated to our line here. We got a pH of 7.40. We're going to draw our normal range again, 7.35 to 7.45. That's my goal of my body, right here, right in the center. On this side, indicates acidosis. On this side, alkalosis. Let's look at our blood gas. So, what's the first thing we're going to do is we're going to look at our CO2. Here I've got a high CO2. When I've got a high CO2, the result should be a low pH. So when I put it through the equation, I get a predicted pH of 7.28. Intuitively, that makes sense to me. So I know that my respiratory vector is making me acidotic. All right? 7.28. Okay, this is my respiratory vector. Let's look what's happened now with our metabolic vector. So our metabolic pH is 7.28. Okay, well, you know what? That's exactly the same. There's no effect from the metabolic vector. That keeps us at a pH of 7.28. So in this case, the effect of the metabolic vector is 0. No effect. So it's all due to respiratory. The best classification I could have for this one is it's just an acute respiratory acidosis. The whole effect on pH that I'm looking at is due to the respiratory component. There's no metabolic effect at all. So this would be consistent with a patient who's just stopped breathing for whatever reason and allowed, or is having ventilatory inadequacy, allowing their CO2 to build up to 60. The result is a pH of 7.28. Okay, well, I think that's kind of cool. All right, so how do we continue now? How do I utilize this in my future studies? Well, I think you need to work through lots of examples. You need to have an example from at least one type of every classification. There's lots of exercises in Malley's chapter 2, right at the end of the chapter. All the answers are in the back of the book there, so this is a really good exercise for you to do over the next few days while this is still fresh. All right, my name's Alan Prost. Thank you very much for looking at this video. We'll see you in class, and remember, email me, come talk to me when you've got problems. I want to be your solution master. Thank you very much.